Hello and welcome to another video production from the Wellness Place. Today, a good friend of mine, Dr. Luke, is going to be with us and discuss another interesting topic. What have you prepared for us?
I thought today we'd talk about teenagers with back pain.
Oh gosh, that's quite a common problem these days as well.
Very common, and more specifically, Scheuermann's disease.
Okay, so what is Scheuermann's?
So Scheuermann's, it's a big long fancy name, but it basically means soft cartilage and the effects of that while we're growing.
Yep.
But it's probably best if I show you on a diagram how it all works.
Are you going to draw something for us?
Yeah, sure.
Thanks.
So I think the best way to describe Scheuermann's disease to you is to show you how it happens. So here we have a normal adult bone. So we can see it's a nice square shape. And I'll show you a normal baby bone, and then I'll show you what happens for Scheuermann's disease to develop. So a normal baby bone is made up of bone and cartilage. Now what happens in Scheuermann's disease is that the cartilage begins to break down. So when we get to the age that we start really growing, the cartilage, instead of normally hardening up as it should do to form a normal adult bone, the cartilage isn't hard enough, so that soft cartilage begins to break down. So we get fraying cartilage, and eventually it does wear out a little bit and wears down. And we also get the disc that sits above the bone. The pressure in the disc starts to push into the cartilage and cause damage there. And the end result, if this is left unchecked and nothing's done about it, is that we end up with a bone, instead of looking like our nice healthy normal bone here, we end up with a bone that looks something like this, where the cartilage hasn't formed well. It's got very weak cartilage, it's quite narrow, the bone, and it forms this wedge shape. And this can create problems for an individual who has this issue for years to come afterwards.
Well done. That was good drawing.
Thank you.
So what kind of signs are we looking for, Luke? When one of our patients is watching this video, what kind of signs are they looking for in their kids?
So with Scheuermann's disease, the first thing is pain. It is a painful condition, particularly during that age group of about 10 to 17.
Yeah.
The pain will usually be worse after exercising, and you'll often find these kids don't want to exercise. So they've learnt from a young age that it's painful if they play sport, so they're often kids that don't want to play sport. Yeah. You'll often find these kids have very bad posture, very round in the shoulders, they start getting quite hunched. And yeah, that'd be the main signs. Yeah, there's many others, but that's a good place to start.
And you mentioned what Scheuermann's was in that diagram that you draw, but I wasn't sure if I caught exactly what the causes were. So what actually exactly causes this?
So no one really knows the exact cause. So there's many causes, but one of the underappreciated causes from the research I've done is nutritional. So as the cartilage is developing, it needs to get the proper mineralisation from the calcium, magnesium, zinc, selenium, all these different minerals need to get into the bone. And you also need what are called fat-soluble vitamins. So these are the vitamins that push the minerals into the bone so that it does form nice, healthy bone.
That's right.
The cartilage. But there's many factors, but I think that's one really underappreciated one about that cartilage. And it's also a point to make that this is an age group that tends to start making their own choices about what they eat.
That's correct, yes.
And as someone with kids yourself, you know that if you leave it up to the kids to make choices, it's not always going to be the fruit and veggies that they go for.
That's correct. As far as the treatment goes for these clients, what can be done for them?
Yeah, so yourself and myself, we're both chiropractors and we've seen many patients with Scheuermann's disease. And one of the most important aspects is that they do get a lot of pain that's unnecessary because of the alignment of their spine.
That's correct.
So you've got very poor quality cartilage, and poor quality cartilage means that the joints aren't stable. They do slip and slide a bit more, and they do get out of alignment. The posture gets affected. So the chiropractic work to improve the alignment of the posture is very important. Other things that need to be considered are the strength and the muscles that support the spine.
So would you suggest exercises and rehabilitation?
Yeah, definitely. Definitely. Strength and rehabilitation is critical in these patients, and also to work on the posture.
Sure.
And also very important that they learn about the activities that are going to make it worse and going to cause more cartilage damage, so they can avoid those activities. And then, of course, nutrition I mentioned.
Yes.
So they need to learn how do you get those minerals into the bone, how do you get those vitamins into your system, why you need to do that. Because it's a very important lesson to learn from a young age, all these things. So ultimately it's going to be good for their health.
Sure. I'm going to ask you one more question before we will let our audience go back to their daily activities. What happens if nobody gets treatment for this? So they've got Scheuermann's, but they don't actually have treatment for it. What happens?
So it's very hard to predict. So a lot of people believe that it's what's called a self-limiting condition, that once you stop growing, that it's all done and dusted, you don't have to worry. But I really think that you can make a difference during the stage that it's happening to take away a lot of the pain. And if you look at the worst case scenario with this, if it's left unchecked, you do get spinal deformity that we call kyphosis.
That's correct, yeah.
It can lead to scoliosis as well. And this is like that hunchback type of position.
Yes.
And that can then lead to sort of social isolation problems, as kids who have these issues will feel very self-conscious. Worst case scenario, you get kids who just aren't very happy, who don't play sport, who have spinal deformity. So
that's correct.
Well worth trying to address.
Absolutely. Well, thank you very much for your time.
Yeah,
I hope you've enjoyed this video, and we look forward to bringing you many more. All the best.